Yes, thank you.
Okay, great. Awesome. Well, thank you so much for that introduction. Very happy to be here with you guys today. I love talking about how we can reimagine healthcare workflows and talk about how robotics and automation and physical AI is going to be making its way into all kinds of areas of our life, but in particular, how we can use that to augment clinical workflows and really take some of the burden off of clinical teams, get them focused on patient care. Um, so I have this talk kind of arranged in a couple different sections. So we'll start off, I'll give you a brief kind of overview of what Diligent is, what Moxi, our product is, and what it does, and sort of why we built Moxi. But then, given the nature of this being a collaborative learning club, I thought I'd kind of peel back the onion a little bit and show you, why, what are some of the physical AI problems that we have to solve, and why is it hard, and what does it look like to put kind of generative AI models to work in the physical environment. So we'll kind of go into a little bit of a tech deep dive, and then I want to like end with thinking about collaborative robotics generally, and like what does it mean to really put robots side by side with your clinical workforce. And so, some stories from the front lines and kind of what it looks like in some of our clients in the halls. Like, what does it look like when you have robots right there working with you? Okay, but yes, please, interrupt. I'm not sure if I'm able to see like hands and things. If I make my window smaller, does that still work for you all?
This looks
Okay,
good,
great.
Andrea, and happy to assist with any raised hands.
Okay, awesome. Great, thank you. Okay, cool. So, like was already mentioned, my background is in robotics, not in healthcare, and so it's been really fascinating for me over the last, 8 years that we've been building Diligent to really, try to find those places where there is an opportunity for automation to really assist a clinical workflow. But I think, what I've been able to see is that there's, really a lot of what we have to solve is the human robot interaction. So that's been my background for years, is thinking about how do we, effectively put robots right next to people and not get in the people's way. Like we really don't want to disrupt people's work. We want those robots to fit seamlessly into their work. So I personally think that across a lot of different places in society, this like people plus robots is going to be a really important problem to solve. And the reason we don't see a huge number of people plus robots out there in the world yet today is that it's very hard to simulate interactive environments and build the kind of models that you need to build for robust dynamic situations. And so that's kind of what I want to give you the flavor of today. But so why would I come into healthcare as a roboticist? Like what's the need here that is really driving some of the value that we're hoping to deliver? Really, we are motivated by the fact that healthcare and hospitals have been in a kind of crisis level shortage of labor for a lot of years. And I think some of the statistics that got us into this field were even from years ago and mostly centered around nursing. But I think the nursing labor shortage is, so it's also true with pharmacy techs. It's also true with lab technicians. So, we're really focused on some of the non-clinical work that these teams are asked to do. I mean, there's stats that nurses can walk 4 to 6 miles in a shift, and that something like 70% of their time might not be spent on direct patient care. So those are numbers that, we're hoping that when you add automation to a clinical team, you can really impact and get those clinical team members kind of back to patient care and focusing on the quality of patient care. So this is Moxi, our point-to-point delivery robot. And so I'll get into what Moxi's for, but what Moxi does is make deliveries of items. So we're really focused on, if you have a clinician that's walking miles in their shift, like why are they walking miles? It's usually to pick up a medication that can't go in the tube system or isn't stocked on the unit, or, take a lab sample that can't go in the tube system, or pick up a piece of equipment that isn't stocked on their unit. So all of these ad hoc deliveries come up on a day-to-day basis, and that's really what Moxi was designed for. And I can back up a little bit. We found out about this, we kind of honed in on this problem after the first year and a half of the company in 2018 and part of 2019. We did a lot of deployments where we were deploying a robot simply to research and learn what people would want a robot like this to do in a hospital environment. So we spent a lot of time with 4 different hospitals across Texas. And we had heard from hospital administrators that they wished that their staff were able to spend more time on patient care. Like, oh, my nurses are running around fetching and gathering what they need for their work all the time. And so we wanted to, dig into that fetching and gathering and say, like, what are they doing? Like, why are they fetching and gathering? So that's where, when we were embedded with these teams, we saw that the number of times that, like, in your day-to-day work, you had to, run across the building to get something that wasn't immediately with you for your patient care was, it's happening every day, all the time. And so as we've been deployed with Moxi robots across the country now, we've seen that this is a daily need, 24/7 across a lot of different facilities. We've done over 1.3 million delivery tasks now, and that equates to real clinical hours that were saved because you're having robots move things around instead of having people walk across the building. So this is what it looks like for an end user to use a Moxi robot. We deploy kiosks around the departments, and here's a pharmacist who gets to call a Moxi to her location. When Moxi arrives, she gets to decide if she wants to deliver one item or fill all 3 drawers. So then she has to use her staff badge to unlock the container, and it locks for transport. And that's an important part of our chain of custody, where on the other side, the nurse that's getting that medication also has to use their staff badge, and that gets recorded with that delivery. Um, so we've been able to take this kind of pretty generic point-to-point delivery solution and help hospitals really look into, am I having team members run things around the building? What are the workflows that we can really automate and take some of that transport task away from people and give it to robots? And this kind of lists out some of our most common workflows. With infusion centers, we see a lot of times the infusion meds are mixed just in time for patients, and you want to get it to patients as you want to, as soon as they're sitting in the chair, you want that infusion med to get to them. So we see a lot of pharmacies and infusion clinics using Moxi robots to get that just in time medication to to the patients. Same for other inpatient pharmacy workflows. Lots of medications that aren't stocked on units or that are patient specific end up being ones that nurses are running around in an ad hoc fashion. Same for lab specimens. If you want to, a lot of times there's a decision to use a Moxi robot if a lab specimen is particularly precious. So if you want to make sure that you don't have to draw that blood again, you don't want it to get lost in the tube system, we see that being a reason for wanting to automate with robotics a lot of times. Yeah, there can be just the, sometimes, there's a lot of hospitals that have wanted to scale like discharge medication distribution or meds to beds programs. And a lot of times we'll hear that they've wanted to stand up a meds to beds program, or, getting more, improving the logistics around discharge medications generally. And a lot of times the only reason they haven't been able to implement a program to get discharge medications out to patients as quickly as possible is just from not having enough people in the pharmacy to run those medications around. So that ends up being a perfect opportunity for Moxi to come in and help to stand up some of those programs. Um, I'll give a couple of examples. I mentioned the infusion center example, and one specific hospital that's done that workflow is Children's Hospital Los Angeles. So we have done over 15,000 infusion center deliveries where Moxi's delivering medications to the infusion center. And the pharmacy there, the pharmacist, the chief pharmacy officer estimates that, the robot is saving 20 to 30 minutes per delivery on, not having staff needing to do that. Lab, like I mentioned, is another important workflow for us. And Northwestern's a great example of a client that's doing both lab and pharmacy workflows. So a lot of times we look and work with hospitals to say, where are you seeing your operational challenges? Which departments are doing a lot of transport tasks with their staff, and how can we look at automating that? Okay, so now I will kind of change gears to dive a little bit deeper into, what are some of the hard problems we have to solve, and how are AI and generative AI techniques really enabling us to deliver on that promise? So some of the things that are sometimes less intuitive that about a point-to-point delivery robot in the hospital, some of the things that are the hardest for those robots to do are navigating in the dynamic hospital environment. So I'll go through a few different examples, but you can really break it down to three kind of problems that are technically needing to be solved. One is just navigating in a busy hallway. The second kind of major technical challenge is opening doors. So, going from the pharmacy all the way up to the fourth floor, you're going to, likely need to open several doors. And so those doors could be ones that you have to open by pushing a button or scanning a badge. And so that's been kind of one set of technical challenges we've had to address. And then a kind of third complexity of navigating in a building is taking the elevator. So we have the ability to use the arm to push buttons to call an elevator, then use computer vision to understand when to get on the elevator, and push buttons once we're inside the elevator. So all of this really enables the robots to enter a building without too much infrastructure needing to be changed in order for the robots to be able to work. And so this has been a premise that we've had as a company that we'd really like for people to not have to um, change very much about their building in order for robots to work. We think that's going to be the easiest way to get adoption and really fit into the workflows that people already have. Okay, so looking a little bit deeper, this is a video of what I guess, the mind of Moxi looks like. So there's a LiDAR and a camera at the base, and there's multiple cameras at the head. But you can see this map that the robot's navigating. That's a map that was built with the LiDAR. And so what happens when we first enter a new facility is we drive the robot around, and it uses the LiDAR to build up a map. So we don't have to ingest floor plans or anything like that. We build up a map. And then once we have the map, we can use that to dynamically navigate to a particular waypoint on that map. And so some of the things that are uh, some of the problems we have to solve and the complexity comes when you have to navigate with people in the environment. So you've got your plan, on the map you need to go, from point A to point B, and then you have to expect that every time you're in a hallway, you're going to see people. And especially at some of these like smaller pinch points like doorways, we always have to be, very much expecting that going through a doorway and as doors are opening, that we're going to be needing to navigate next to people. And so we have to have that as an expectation, and that influences the planner in order to make sure that we're navigating safely around people. Here's a fun one. It was one of our early deployments. So we had with a hospital that we had a nursing staff that said, I don't think this robot's ever going to be able to work in our unit. It's just too crazy here. I think, we've got too much going on. There might be equipment, there might be other things. So we said, well, let us just we'll just go ahead and map here, and you can decide whether or not you wanted to use it. And so one night they set up an obstacle course for the robot because they were like, I don't know if I trust this. And then they sent us this video and they said, oh my gosh, Moxie did it. So I think, one of the things that's been really important to us is making sure that Moxie's designed to go anywhere that people can go. And so being able to fit through tight spaces and navigate safely, all the way down a busy nursing unit or a busy ER. The utility of that robot's going to be coming through if we can go to anywhere in the hospital that you might want to deliver something. So now I'll go through just a few examples of things that we maybe didn't expect, or lessons that we've had to learn from deploying a fleet of robots, and that gets directly into why we need generative AI and physical AI to solve these complex the ability to navigate and behave in complex environments. And it's because we have to be continually learning from all these use cases. So one would just be like over the hours and hours of experience that we have. Now we've seen so many scenes like the one that you're seeing on the screen now, where it's just the dynamics of how you expect a big cleaning cart to come through. You expect to have like lots of equipment on the left and then sometimes on the right, and then people, coming across you. Like these are all things that they're really hard for a robotics team to simulate in before coming into an environment. It's we can do a little bit of a simulation, we can build a model, but you really need to have that kind of real world experience that you're adding to your model over time. Um, the other is just, you think like, oh, deploying an ADA button pushing robot to open doors, you think you're only going to have to deal with this first kind of button. It's just, okay, it's a button, you push it, the door opens. But over time you see that, sometimes the button is right next to a cabinet, so it's really hard to get to, or sometimes there's a dual device button. We have to scan a badge and then push the button. And so sometimes people put a hand sanitizer in between scanning the badge and pushing the button because they want people to you know, wash their hands while they're pushing buttons. So all of this is just the simplicity of, oh, you just have to push buttons to open doors. It actually in the real world turns into a class of like 50 different things you have to do in order to have a robot that could open doors in any hospital environment. Another lesson that we've learned after being deployed was around interaction and how much people were happy to help. So that was really interesting to see that, even though we had a robot that could, push the buttons to operate the elevator itself, what we learned was that just like you would with people, if Moxie happens to be in the back of the elevator and there's other people in the elevator, and you say, hey, could you push if you could you push floor 2 for me, please? People are happy to do it. So that has been a successful use of interaction as part of the behavior. And then other things are kind of more specific to kind of healthcare and the norms of particular hospitals. And so this is an example of when you're riding an elevator, the door opens and you can clearly see that there's a patient bed that wants to get on. The robot needs to get out and yield to the clinical work that's happening in that building. And so these are all things, again, that we couldn't imagine and simulate ahead of time. You have to learn this as you're out and deployed in a dynamic environment. So that leads to, what are we doing with generative AI models? We're taking, you have like an initial model, like I mentioned, that you could have and your expectations of, how the world's going to be, what it's like to have to push a button to open a door on a wall. And you put that model out into the world, and you see all the places where that model works. And then you see the places where that model doesn't work. You can collect a little bit of data about new situations and feed that back into your model to now be able to handle those new situations. So our robots are able to process multimodal data. So it's LiDAR, some camera. We don't do audio for privacy reasons. And but it's 300 terabytes of multimodal data is processed every month to really to learn and grow and expand the capabilities of the robots. And what this looks like from a generative AI perspective is a vision language action model. So we're taking inputs like LiDAR, language, camera, navigation behaviors, arm behaviors, and all of that feeds into a world model that then can output, it has output heads for perception, navigation, and manipulation. Okay, so before we transition into the Q&A session that we talked about, I want to go ahead and just show a few real examples of, I think there's a lot of what we've talked about is like the kind of technical problems of solving navigation and manipulation in a hospital environment. We've talked about the kind of work that there is to be done of delivery tasks and, all of the medications and lab samples and things that we're carrying from point A to point B. So it's all very utilitarian. Like this is a useful utilitarian thing. But I think what we were even surprised about and have been continually surprised about over the last few years of being deployed is how endearing people are with the Moxi robots. These robots are actually really joining a team of people that are working hard to deliver the best patient care that they can. And so it's been really great to see. We box the robots up in our headquarters. They get shipped out to a loading dock at a hospital, and they get welcomed into teams of people that are excited to not have to run around the building. They're excited to hear that they get to use robots to do some of their transport tasks. But they really get to they have a fun time. This is someone who actually this was on Moxi's first day. This nurse showed up because she knew about Moxi from a friend, and she was so excited to have Moxi join the team that she dressed up with her Moxi sunglasses and took a photo on the first day. We've had all kinds of people dress up Moxi. Moxi gets dressed up for almost every holiday. This was like a big thing we had to do early on is publish some recommendations for costumes and point out like you can't put something over the camera. We really need that. You can't put something over this sensor. We really need that. So it's been great to see how creative people have been with the costumes that they can put on the robot without covering up any of the sensors or places that are needed for work. We even had somebody dress up like Moxi for Halloween one time. We had we had a team that celebrated Moxi's 1 year birthday of joining their team. We've had Moxi, we've spotted Moxi on several team boards, so they truly they truly think of Moxi as having joined their team, which I just love. That's really cool. And this is one of a video that one of our customers sent us one time. I just think it really epitomizes what I would like to see in terms of adding robots into a human environment. You don't want the robots to feel like they're a lot of work to be around. You don't want people to feel like they are getting in the way. So you really want people to feel empowered and you feel like these robots are helping them do their job better. So, with that, I am happy to transition to taking questions, and I'd love to hear what this group's biggest questions are about robotics in hospitals and healthcare and physical AI generally.
Yeah, this is amazing, Andrea. This is like everything I was hoping for and more. The You covered so many different pieces of it, right? Like there is the technical piece, there is the whole what is currently needed, what are the bottlenecks for the healthcare workforce piece, starting from there, and how to actually deliver something that is technically feasible in real environments to the human element of it. This was absolutely wonderful. So before I open it up to questions, as mentioned, let's do a little bit of an interview piece. I prepared some questions for you just to kind of pick your brain more. So
Sure.
I want to jump right into the what you see as the trajectory of AI enabled hospitals. So, how do you see this evolution of both the software based AI and this embodied AI like Moxi and other kinds of technology shaping hospital operations? So, over the next 5, 10, 20 years, and for clinicians actually working in the hospital, what will feel fundamentally different in the near and far future?
Yeah, those are great questions. I don't know if I have all the answers there, but I think that what we're seeing in physical AI is we're just scratching the surface of what these robots are going to be able to do. And I talked a little bit about that learning data flywheel. And what's absolutely true with all of AI's advancements is that the speed of progress is directly proportional to the amount of data and experience that you have. And so I think that's true and across the software-based AI solutions and the physical AI solutions. As we have, now we have about 100 robots deployed, interacting with the environment and learning every day. So that becomes this flywheel for increased behaviors. What we're going to see in the near to midterm is being able to handle more. Handle more complexity and be able to navigate really busy areas with ease, and then going beyond just point-to-point deliveries to start to see robots that could um, do more dexterous manipulation tasks. So instead of just being loaded and unloaded by a person, maybe the robots are able to go to a place, pick something up, do something that is has more high dexterity. So I think that's the dimension that you're going to see really take off over in the coming years. Yeah, I think that's probably my biggest forecast for you.
Yes, thank you for that. And that data flywheel totally makes sense because that is how we will build, and the pace will only accelerate, I imagine. So, as the AI is adopted, the organizations need to be ready to work alongside this AI. And maybe Moxie has an advantage there because it is so human like, right? Like people kind of bond with it. But in general, from an organizational readiness perspective, so what drives this successful AI adoption in healthcare? Like there's the technical capability piece, there's the workflow integration piece, and then there are the cultural factors, right? Like the trust and literacy. So are organizations investing proportionately in these true drivers of success, or do you see some kind of a misalignment there?
Yeah, no, I think there's a huge I think there's a huge need for focus on change management when you're talking about introducing either a AI software or physical AI solution into the workforce. And because you're wanting to change the nature of people's work and what's happening, or the nature of your operation, and you're wanting to give some task that was previously taking a person some amount of time to do. You want to hand that over to an AI or a robot and free up that person's time to do other things. So the effort that goes into kind of reimagining that workflow and making sure that we're making the right decisions about how that handoff is happening between what you're having AI do and what you're having people do. I think that's the first step, is like getting really good at thinking through all the ins and outs of the workflow design and the operational design. Some of the best implementations that we've seen of Moxi robots are when the team at the hospital really understands their workflows and really understands where their bottlenecks are today, and then we can really apply automation most effectively. But even if you've designed like a really great new workflow and you've got, okay, this is going to be, better for people, they're not going to be running around, or, they're not going to have to think about this task anymore. We're going to let AI do it. Like you can come up with a great design, but getting that introduced to the workforce is really important. And I think people are really nervous about AI today in the workforce. And so I think addressing that head on and really explaining as an organization, like, hey, this is our stance. Here's where we think it's useful. Here's where we want to have our people power focused on right now. Again, some of the best implementations that we've seen, they've been really good at being forward about, this is what these robots are for, and we want to, have a chief nursing officer that's introducing the Moxi robots and telling her staff, we want you focused on patients. We don't want you running down to lab. We don't want you running down to pharmacy. That's what these robots are for. And so you're really just kind of getting people to feel comfortable about what they're for. And also, I would say a lot of times, especially busy clinicians, they don't want to change the way they're doing their work. Like they come into work, they know what they're doing, they're focused on the quality of care for their patients. They don't really want to think about technology, and they don't want to think about like learning a new technology unless it's, truly going to help them. So a lot of times we've seen the frontline clinicians, they almost need permission to use a new technology. It's not the training as much as, oh, I didn't know if I was supposed to use this robot for this. And so being really clear about, here's this new AI tool, whether it's software or a robot, and, being really clear about what it's for, what it's not for, and making that just like really simple so it can kind of spread like wildfire throughout the staff and people can talk about it in the elevator. Like, what's that robot for? It's like, oh, that's for teleboxes, or that's for infusion.
Yeah, that's awesome. So there is the today where we are today and how slowly things get adopted, and then some of the things that you're presenting almost feel futuristic. And I guess things are going to look even more and more like science fiction in the coming years. So I'm curious about this inflection point, right? Especially for the embodied AI. So what do you think needs to happen both technically and economically for this embodied AI to scale as broadly as the software AI has been scaling in healthcare and in our daily life? So, what are the key unlocks that help us get there?
Yeah, I think that so we're continuing to see robots in several different environments, and hospitals being one of them, gaining more traction, getting more deployments, and through deployment, we get access to experience and more information. So I think there's, we're seeing costs drive down in hardware across the board. So we'll continue to see it being more economical to deliver robots to, all kinds of different environments. So I don't know that there's going to be one tipping point, but I think that, especially for hospitals, I think that, there's not going to be a moment where, I live in Austin, and there was a day that like all these autonomous vehicles showed up and they just started like working, and like, sometimes they're not working, sometimes they are, and they're getting a little bit better over time. Like, with hospitals, it's not going to be like that. It's not going to be like the scooters just showed up one day and now you have to deal with all these scooters in your town. I think the we have to be more concerted and plan, you take kind of a slower adoption. I don't think there's going to be like a tipping point where all of a sudden the robots show up one day in healthcare, because we have to, ensure, to think about, really thinking carefully about privacy, thinking carefully about safety, and making sure that we're growing with trust. I think that's the key factor is you want to trust that these robots are going to be safe and effective in the environment.
Yes, healthcare is hard because it is like every decision is about people's lives, right? So this is it's amazing the work that you're doing. So the last question I have for you is a little more on a personal note. So you have gone from academic research to deploying robots at scale in hospitals now, and now in the next chapter with Serve Robotics, right? So what have been some of the defining moments in your journey, and what are you most excited about next?
Yeah, thanks for that question. I would say like in my academic part of my career, I was always just very focused on learning the latest and greatest things in robotics and machine learning, and particularly applying those to human robot interactions. So I've always been really interested in like when are we actually going to see these robots in our everyday life? I mean, we like even still today, you see videos of robots every 10 seconds on YouTube or TikTok or whatever, and you can walk around for your entire day and you will probably not see a robot. And so that has got to change one of these days. And I've been kind of obsessed with like, what is it that's going to have to change to really unlock.
Looks like Andrea's connection froze. Christy, are you with us?
I am still here. Do you want me to let me text her and see?
Commercial attempt at making that
She's
happen. Oh, did
you
my
froze there for a second, but you're back now.
Okay, great. Yeah. So for with Diligent, that's been my first commercial scaled, getting robots really out into a human environment. And I would say that's been the most fascinating and impactful part of this is actually, seeing the thousands of nurses that get to interact with robots every day. And if I get to go to one of our sites, I love just watching my favorite thing is to watch the robots from like really far down the hallway. And so the person that comes out of the lab to take the sample out of the robot, they don't even see there. You just get to see people like interacting with the robot as part of their everyday life. And I think the first time that I saw that, and like no one on our staff was around, and they're not and people in the hospital, they just like knew what to do. That was really special. It was, that's more than it's so impactful, compared to doing experiments and writing papers about it. And then looking forward, I think I'm really excited about we were recently acquired by Serve Robotics, and so we're part of we're part of expanding, helping them expand their market and focus into indoors and into hospitals. So it's great to have such a partner that is um, really at the forefront of physical AI as well. And they have 2,000 robots deployed. And so, back to this, like, what does it take to really get to that next generation of physical AI? It's deployed robots having real experiences around people and in interactive environments. And so we're very focused on getting to that next level of interactivity and scale. And I'm excited about that.
That's awesome. Thank you for these answers, Andrea. I want to open it up to the audience now. Are there questions you have for Andrea? While we are waiting, I want to ask you a technical question, Andrea. So you mentioned that like so you have this multimodal data like the LiDAR, and so like that reminds me a little bit of something like a Waymo, right? Like they also have
Mhm.
LiDAR technology. And you mentioned world models. So do you do like is your is this work based on the transformer architecture, or is this entirely different, the world model architecture that you're using?
Yeah, no, it is a transformer-based architecture. Yeah. So it's very much based, it's a very similar concept to like LLMs, but transitioned to multimodal tokens. So being able to do, words, images, LiDAR, like our a lot of our sensor base is very similar to autonomous vehicles, but using sensors that are tuned for indoors. So like our LiDAR is, for several meters instead of hundreds of meters and things like that. So tuned for more like near field perception.
Thanks. Does anybody have other questions?
Hi, my name is Jasmine. I'm actually in Silicon Valley and not with Fred Hutch, but we actually use Moxi, and when I first got here, I was like blown away, and it's really a privilege to meet kind of like the brains behind the beauty of Moxi.
That's
The brains
awesome.
and
Nice
the
to meet
beauty
you.
behind the beauty of Moxi, but and I wonder how you're introducing the not just the first generation but the future iterations of Moxi to the youth to get them excited about the application of AI, right? Because I see the excitement in your face when you talk about seeing Moxi in the hallways and things like that. So how do we, like, I'm a mom of 4 kids, right? 4 teenagers, and so how do we sort of like introduce what's in real life? I mean, it applies to so many things, but since you're kind of the primary speaker today, I'm just wondering what your
Yeah.
company is doing to get that exposure for the kids.
That's a really great question. I would say, we make an effort with a lot of times we end up doing that together with some of our hospital partners. We've certainly had a number of kind of events, and I think really for kids, like we could bring them into our headquarters in Austin, but you're not going to see, it's not the same as seeing robots in action in the hospital. So we've had, a number of like Boy Scout troops and Girl Scout troops and other like youth groups that the hospital themselves, and usually whichever team kind of owns the robotics and implementation, they've like invited their local youth groups to learn more about Moxie. And then, so we'll get involved in do like a Q&A session and a demo and things like that. But yeah, I think there's a lot more that we could be doing in that respect.
I would definitely take you up on that Austin tour. We used to live in Dallas, so I would
Okay,
definitely take you
great.
up. Yeah, thank you.
Yeah.
Thank you, Jasmine. Bryce?
Hi, I'm Bryce Romans here on the IT side at Fred Hutch. I'm curious, are there sites or locations that have rolled out Moxie and then encountered issues and then, scaled it back? And if so, what were some of those issues?
Let's see. We had, like, early on we had sites that like we've typically, we do a pretty good job ahead of time of doing a site assessment to say, like, are there going to be any issues? Does it make sense to, like, is the robot going to be able to navigate this environment? There, sometimes if there's too many doors that are not automated, for example, like we don't do door handles, and so there has to be kind of an ADA compliant route to get from point A to point B. So I'd say that's been maybe the biggest pain point for a couple of hospitals that had workflows that they wanted to turn on, but then there were like two doors that were not automated between wherever they wanted to deliver things and the lab. So I'd say like those kind of physical, environmental are probably the bigger ones.
I'll follow unless anybody else has another question. Do you see these employed in kind of scheduled route-based workflows instead of like ad hoc call-based
Yeah.
workflows?
Yeah, so we actually have three or so ways that we can set up workflows. So we started off with just the ad hoc, like, hey, here's this app, call the robot, like Uber Eats whenever you want it, kind of thing. But then, like you're mentioning, there were some workflows where it made sense to say, actually, we just want the robot to show up here every hour. And really pharmacy to infusion clinic was one of those. It's like, hey, during the hours of 8 a.m. to 2 p.m. where we have people in seats all day and we just need, or we're going to want to have those infusion meds going back and forth. We'll just have a setup where you don't have to call the robot or tell it anything. It'll just go back and forth between these two locations as fast as possible during a particular time. And then I guess the fourth way that we're about to be able to, we have a couple of proof of concept implementations, but it's going to be something we're doing more in the coming months, is electronic health record integration. So being able to have the robot automatically show up somewhere based on some information that's in a patient's health record. And so then you wouldn't have to, as a clinician, say, I need a Moxi. It would just know, like, oh, this patient is being admitted to the telemetry unit. I'm going to go to central monitoring and get a telebox, and then I'll show up and it'll just be like magic.
Thinking about courier workflows, is there work being done on kind of automating intake or loading itself versus that manual process? I guess ultimately I'm thinking of a specimen courier process where, say, you define a route and have it visually assess whether there's a specimen in a tub, and if so, right, load it or else move on, and kind of could this, and
Yeah.
it's close to working for that workflow.
Yeah, absolutely. I mean, so that is like squarely in the fairway of like what we would see for that roadmap of increased dexterity and increased manipulation capabilities for sure. Being able to self-load and self-unload would be on that roadmap. There's some things that I think it works for lab and for supplies especially. There's some other workflows around pharmacy in particular where they really want that chain of custody, and so you'd have to work out how the robot becomes part of the chain of custody if it's loading and unloading itself. But I think those are really interesting questions to try to figure out for the workflow like that.
We also use it for wayfinding for patients after their check-in process, so that's also helpful in another application. The other thing I wanted to point out is that there I don't know if it was intentionally done, but there was some folks that followed the robot and went from floor to floor. And so I wonder if there's any way for the robot to be mindful of, like just someone sneaking up on them, right? In order
Yeah.
to get access into the places that visitors might not have otherwise access to. So I wonder if that's an opportunity.
Yeah, we've talked about that. Similarly for opening doors, like if the robot has access to a unit and it's using the badge to get access into that unit, like how can we notice tailgating and report it? I mean, we certainly have cameras, so we could easily send a video to security or otherwise and say, hey, we noticed tailgating, FYI. So that's probably the best solution. A little bit like, ATM machines, you just like handle security by having a lot of documentation.
So, Andrea, what sounds interesting to me is also what you have chosen not to do, right? So you have defined a very specific use case and then kind of gotten like really good at that. So this is in some sense feels to me akin to something like AlphaFold or something, right? Like it's a model for for one specific thing. But then there are the large language models that, write poetry, talk about theory of relativity, and do all kinds of things, right? So going back to a little more like Bryce's point, so do you see at a future point like a robot that's basically like a nurse, right? Like because there are hundreds of possible things, tasks that might be needed, and do you see at a future point a team member that can adapt and do what is being asked of it uh, on the fly?
Absolutely. I think that's where this needs to go. I think for like especially physical AI, like a robot, it's not going to make sense to have 10 different robots for 10 different things. You're going to want to have a relatively general purpose robot that can do a number of different tasks in the same environment. I think we'll continue to steer away from like clinical tasks and leave all the clinical work to clinicians, but there's just so much assistance and augmentation of the clinical staff that's available. And you could certainly have a single robot like Moxi or an iteration of Moxi that could take on much more than just the point-to-point delivery that we're doing today.
Thank you. This is amazing. It's very thought provoking, right? Like you can start imagining what tomorrow's healthcare might look like, especially in this embodied AI dimension as well. So, are there any last questions before we end for today?
Thank you so much. It's really great to meet you and like learn.
Yeah, no, thank you for
More
the
about it.
opportunity. Glad to
And
see
thank you.
everyone like expanding their skill sets and asking important questions. And yeah, I'm excited to see the future of AI plus healthcare.
Thank you for joining us, Jasmine, today, and to Christy for making this happen. And most of all, Andrea, really, really thank you for spending your time with us. So, this talk is recorded, and I'll be posting it on YouTube, and I'll send a link. For next month, our talk is again at noon, so it's a different time again. So, I hope you can join us. Mike, I see you're on video. Did you want to ask a last question before we end it?
No, I'm fine. Thank you.
Okay. Okay. Yes. Thank you very much. Thanks, Andrea. I really appreciate your
Thanks,
time. Thank
everybody.
you.
Thank you.
Bye.